All right. Hello, everyone. My name is Marika. I am the outreach coordinator of Medical Wonders, and welcome to Medicine Week 2022. This is the third, this is the third day of the Medicine Week, and we have Dr. Anjali here with us, and I'll just go over some of the rules of this program. So, first off, you have to attend 2 or more calls from this week to actually get your attendance. And for even your attendance to verify, you have to submit a 5 to 6 sentence paragraph about the calls and what you've learned from all the doctors. So we have a different doctor every day. So this form or like this document that you send is should be sent through Google Classroom, so from the corresponding doctors. And the paragraph should be detailed and along with your full name in the paragraph so we can check off. Anything else? Also with the program, you will get, or with your assignments, you will get your certificate if you've attended 2 or more calls and you submitted your paragraph along with your hours. And the points below the green highlighted text is some of the points that you can add on your resume for attending these calls. So what is Medical Wonders? It's a student-led nonprofit organization to educate and advise students about astounding medical procedures, careers, discoveries, and devices. We are a pretty big organization with 4 executive teams, researchers, editors, communicators, and graphic designers. And we have a number of members along with 50 tutors and 10 college overseers. So it's over 300 plus people. And we've also collaborated with a lot of other nonprofits to make, what Medical Wonders is. So what exactly is Medicine Week? Every day this week, a medical professional or student will go on Zoom call with us for an hour presentation or introduction to our studies. And at the end, we'll have a Q&A session with them. So we also have our Instagram, which I'll show you at the end of this call, but you can also contact us with anything. And all of our medical professionals also have their own Instagram accounts if you want to ask more questions after this call. So all the calls will be recorded in our YouTube channel so that you can go back if you missed something for your assignments or you just want to rewatch it. So that was about all. And I will stop sharing and let Dr. Anjali take over.
Hi guys, it's really nice to meet you. I'm really excited to be spending this kind of afternoon with you and kind of talking about my journey to medicine and what I do as a psychiatry resident. So a little info on me. I'm a 3rd-year psychiatry resident. There's 4 years in all, so I'm closing in on kind of the end of it. And I'm out here in Ohio in a program.
Dr. Anjali, you're not sharing your slides, sorry.
Oh, you're okay. I was just talking. I can start the
okay.
slides.
Okay.
So we can get that pulled up. So I made a brief slideshow for y'all. You guys can see the PowerPoint?
Yep.
Background, awesome. Okay. So we can start off. So we'll be talking to you guys a little bit about psychiatry today. Here's a little bit of an agenda for you. Planning to talk about my journey to medicine, give you a little office tour of where I work, my office, a general day in the life of like what my work looks like, and then have time at the end for a Q&A. So I feel like the big question to start off things with is often what drew me to medicine. I added this little picture of a family here because that was a big driver for me. My dad, when I was growing up as a kid, was really chronically ill and actually spent a good deal of time in and out of the hospital. So I spent a lot of time visiting him and got to see kind of firsthand the impact like a doctor could have on the ultimately like the course of a medical illness that affects like a family and a loved one. And I found it to be really interesting and one of the most inspiring things I had experienced at that age. And that was a big thing that drew me towards wanting to also be able to have that kind of lead role in caring for patients, working through medical illnesses, and be able to like lead a team in that way. So that was a big thing that inspired me to come to medicine. So my journey to medicine ultimately looked like this. I did 4 years of high school. I did a 2-year college accelerated program. It was called a BSMD program. So I completed a bachelor's of science at a designated college associated with my medical school. I went to school like all year round. They kind of designated the classes we had to take, and we had like certain academic requirements we had to meet to complete the program in 2 years and come away with like a bachelor's of science. And then once that was accomplished and like a certain MCAT score was accomplished, we could matriculate over to medical school, where I spent like a general 4 years of medical school. In my 3rd year of medical school, I found that I really loved psychiatry when I was able to rotate through it during clerkships, and I never looked back. Now I'm 3 years into my psychiatry residency, and I've got a bit over like 1 year to go. So some reasons I chose psychiatry over other fields. So the field focus, I feel like psychiatry for me was the most humanistic field in medicine. I really liked that I got to know patients as like people and not just like diagnoses. I got to know them as people dealing with things like depression and anxiety and what kind of stressors cause those things in their lives versus just talking about like their diabetes. So those were topics I enjoyed interacting with patients on more so than the others. And that was one thing that led me to it. I also really liked incorporating therapy over just like medication management and kind of talking with patients about ways they can effectively like manage their own moods or anxieties, etc., and kind of like help them learn about themselves in interesting ways that ultimately like give them a lot of power in terms of like approaching stressors and stuff. So that was a really big draw for me, particularly also like the amount of time we got to spend with patients. I found I was on inpatient psychiatry able to spend the most time with patients compared to like all my other clerkships. And I really enjoyed that. Kind of again, going back to the fact that it made it feel like a very humanistic approach that I could like sit down with someone and spend a good deal of time getting to know them before we led to like conclusions or treatment or anything. There's also sometimes a good deal of detective work involved in psychiatry, kind of calling for information and digging in charts and putting pieces together when we don't have necessarily like the most objective data. I found that really fun and like in a problem-solving detective kind of way. I really enjoyed that. And I find that I'm always learning. In psychiatry, I find that even from patients, I'm always learning something new, and I love that. There's also a good deal of community involvement. So frequently, especially in the program I'm in, we work with the community a lot in terms of like patients who are marginalized or have severe mental illness or need significant community resources in terms of like help with housing, help with social security, food stamps, things like that. So I like working with those populations a lot, and being able to have an active role in the community and see people progress successfully in the community is really meaningful to me and really hits on like my own social work kind of initiatives that I've really enjoyed since high school. And then finally, like the pathology in medicine, I loved. I found the spectrum of pathology you see in psychiatry to be very interesting, from mood disorders, depression, anxiety, things we like hear more about, bipolar, to like psychosis and addiction. I think it's a very interesting range of topics, and I find all of them very interesting. And also, notably, compared to any other like topic in medicine or field in medicine, I found I never really got bored reading up on psychiatry topics, like mental health topics, even like pathophys topics, which if you all have taken like molecular bio, some of that stuff can get really dense, but I still found it pretty interesting. So I thought that was something notable to myself, that I could still enjoy like reading up on even dense topics of it. And the fact that there's kind of always something interesting and new on the horizon, whether that's medications, different treatments, therapy interventions. So I like that it's a perpetually like growing field with like a lot of exciting new opportunities on the horizon. So the big question of what I do as a psychiatrist kind of in my day-to-day. So ultimately, I work with people to address struggles that are emotional. So struggles with their mood, with worry, anxiety, sometimes with connections to reality, and sometimes to addiction. So we work with a varying spectrum of kind of struggles with emotion and life. And I get to know people in like several life domains, which I really enjoy. So I get to know about their work, their interactions with people in their life, whether that's like loved ones or friends, how they interact at jobs outside, what kind of life stressors they've been carrying with them. I think it's really nice to see like a full-fleshed story of a person and get to like have all of that be important information for treating them. I also get to talk about like medication and therapy options to address all of the above struggles. And I also get to help people in emergent situations when kind of all of those emotional struggles reach a climax and questions of safety are apparent. Also, I get to increase awareness about mental health struggles and kind of advocate against the stigma that exists against mental health. I really feel strongly about both of those things. And I'm at a teaching hospital, so I get to teach and mentor students, whether that's medical students, college students, you folks here today. I really enjoy that mentorship and teaching, giving back. So all of these things are things I enjoy and things I like to do as a psychiatry resident that I'm happy are part of my day. So kind of what a day in the life looks like. So the three kind of broad domains I like work in are the inpatient psychiatry setting, the outpatient psychiatry setting, and the emergency room, which is usually where I'm at for call shifts. So I thought we could break it down in that way because they all kind of differ. So in inpatient psychiatry, we work with patients who are in like a more acute setting, whether that's because they're very depressed, whether their psychosis is really interfering with their ability to function or take care of themselves. They're usually very acute and requiring inpatient care. So we see them on that side. Typically my day on the inpatient side would look like me coming in around 8 a.m. to pre-chart and pre-round. So pre-charting would just be me kind of looking through the notes from the night before on how things have went with the patient, if there's anything that happened, like they refused their medications, or they had a phone call from family that they informed staff about, or they had an interesting interaction with staff. So kind of looking to see how the night went for them. And then sometimes also pre-rounding. So rounding would be me seeing patients with my attending typically, getting to check in with every patient on how they're doing, from how the medication is going, how their symptoms that they presented with are evolving, if they notice any side effects, and if there's any kind of like developments in their case in terms of like communications with family, communications with court, kind of et cetera. So pre-rounding would be me going without my attending to do those things. And I usually pre-round on like patients who are newly admitted the night before, or anyone who like seems to have like some dire need, like if they were acutely like aggressive overnight, and needing maybe additional medications that the nurses can use to help calm them down. So that's usually my day for like about an hour. I'll read up on patients and see if there's anyone who needs to be seen. Typically my attendings come in just a bit later, around 9 o'clock, and then we see patients essentially for a couple of hours. Anyone who's on our list we'll spend time with, usually like, it really varies on the patient, but it can be like 20 minutes to an hour per patient. And then we usually leave the afternoon for like grabbing lunch, finishing notes, because documentation is like a ongoing facet of all these domains. Also connecting with families to call them for either information or updates on what's happening with their loved ones, and kind of finalizing orders. That would be like medications or things like their orders for discharge and going home, and making sure their discharge plans or where they're going home, whether that's like a rehabilitation site, to their house, to a group home, that those things are kind of squared away. In the outpatient setting, which is where I'm primarily this year, third year of psychiatry, you're basically doing outpatient all year. I usually come in and see patients essentially around the clock. So I'll come in around 7:30. I start seeing patients at 8, whether that's for an hour or a half hour period. I take a break for lunch, catch up on notes. I'll make phone calls to usually patients like therapists to be on the same page in terms of medication management and therapy if I'm not the one conducting it. And then I'll see patients through the rest of the day. Patients I see in outpatient are usually more stable, less acute, folks who are usually like able to take care of themselves, functioning pretty much normally in their day-to-day life, able to hold down their jobs and don't have a lot of like acute needs in that way, but are seeing me for things like medication management to affect their mood, anxiety, psychotic symptoms, etc. And sometimes therapy to address all of the above, but kind of without medication. And then lastly is the emergency room setting. So the most, I guess subacute would be what I would call it. In residency, we take call shifts where we're staffing the emergency room, usually from 5 p.m. to 11 p.m. most days. On the weekends, we do 24s. On the weekdays, we go after our work is done on the inpatient or outpatient unit. So usually there, we're evaluating patients who have come to the emergency room with acute concerns. They usually involve safety. So that's usually whether someone's feeling suicidal, unable to keep themselves safe, having thoughts about harming someone else or feeling homicidal. They seem very impaired to the point of not being able to take care of themselves. That can happen with depression, that can happen with anxiety, that can happen with psychosis or substance use. Or they feel that things have gotten so bad that they would like to come into the inpatient psychiatric hospital. And so we assess those patients and determine kind of their disposition or ultimately where they go, whether they go to inpatient psychiatry, they go to a different facility, or they end up going home. In that setting, we often will talk to patients, we'll talk to their families, we'll kind of call around if we need to in terms of like gathering information. This can be where like a lot of that detective work comes in. And then ultimately, so we're the ones kind of gathering all that information, putting together a presentation and deciding on a plan for disposition. Then we go over that with an attending and they'll agree or disagree, typically agree. And then we write notes on those. So that's usually our day after work, maybe like twice a week. Given, it kind of depends on like how many people we have in the call pool at the time, but rounds out to about like once, twice a week, 4 times a month or something. So here's a look at my office. It's my outpatient office. It's small. It's not technically mine. I've inherited this, and it kind of just like runs the course through the residents as they approach 3rd year and they end up spending more time in outpatient. But here's a little look at it. I got my couch. That's where I see patients. The computer was where I document. I'm a big houseplant lover. I have lots of plants. I tried to make this place look cozy. And I've got a bookshelf that I'm kind of filling with books that I found really helpful. So really small, but kind of trying to make it my own, make it a cozy place for people to talk about things that are pretty hard. Let's see. Okay, so that's kind of all I had. I wanted to open it up to questions. I will preface with the fact that I usually, since this is going up on YouTube, I usually keep a lot of my information private on social media for my own like safety and privacy concerns. But if there's any like very personal, very specific questions, I'm happy to answer them in email format. So I can pop my email in the chat.
All right, so if anybody has any questions, you can either insert it in the chat or just like speak out. All right, I'll start off with some of my questions that I have for you. So I think the biggest one would be, we have a lot of people who signed up as a high school student and also college students, but majority are high school students. So any advice for like high school students that you have? Like maybe like from extracurriculars, because I know since I am a high school senior, there are a lot of competitions for like colleges, you know, so especially for pre-med. So any advice for them?
Yeah, so my ranging advice dates back to like when I was a high school student. It's strangely been a good couple of years now. But at the time I often like recommended shadowing when you could. I am a bit lucky, my mom is a nurse. So she spoke to people she worked with and said, hey, my daughter's interested in medicine. Could she come see you for a day or something and follow you around? And most of the people were pretty nice about, yeah, sure, why not? Honestly, apart from this, I also just like cold emailed hospitals that were local to me, asking in their like volunteer departments, I believe, if they had any opportunities for people interested in pre-med to come shadow, and if they would let me. Sometimes I got no's, sometimes I got yeses. I felt like the worst I could get was a no, so might as well ask. So I often recommend like shadowing. And also I know scribing is huge now. This was not around when I was a high school student, or I wasn't aware of it at the time, if that's the case, almost feels like a chance to get paid to shadow and then also learn a lot about the medical field and like functioning in the medical setting. That's kind of beyond even like what you'll get until you're like a third year med student, essentially. So highly recommend if there are opportunities for that around to check them out if you can.
All right, thank you so much. And the same type of question for college students, like undergrad or grad.
Yeah, so in undergrad, similar things. Honestly, I do recommend like doing what you enjoy. I think medical schools and colleges in particular really liked seeing you being able to like follow your passions and being able to incorporate them, because I think it's important to be like a multifaceted human and be able to embrace all of the parts of things you like. Like in college, I did like a choir and I really enjoyed it. And it was very like different from all of the other stuff I got to do that was like medical, but it was something I was passionate about and I was happy I got a chance to like make time for it. Medically, like focus things. I, with a bunch of friends, was volunteering pretty regularly at our local hospital. I was lucky because it was pretty close to the college campus. And I think we did like most Saturdays there. A lot of the hospitals are happy to take volunteers, especially, I guess, so now that it's not that we're like out of the pandemic, but I think we're trying to normalize opportunities a little bit more, and offices are kind of more open for things like volunteering and whatnot. So I think that also like volunteering in other settings that are like medically acute, that could be like nursing homes sometimes. There are many camps that happen if you like enjoy working with kids or even like adults. There are several like camps for different subsets of kids, whether that's, I have a friend who like loves going to a type 1 diabetes camp that happens every year. I have friends who go to a camp that's primarily taking kids with cancers. A friend that goes to one that has primarily like adults who have developmental delay. So kind of several opportunities in terms of like what you feel like you'd enjoy the most to investigate.
All right. So I just wanted to ask about BSMD programs out of high school. Do you think it's worth it? Like, did you ever try, just like talk about it, elaborate it?
Yeah, and I can talk about that. And I see Hafsa messaged about the same thing. So I can talk about that. So I did the BSMD high school route. Right out of high school, I applied my junior year, I think probably my junior year, and then was accepted around my senior year. Went straight to high school. Wow, went straight to college for that 2-year route. And then it was all year round. And we took like a large course load of courses, like very science heavy. And I'll be honest, it was quite a lot. During the time, I know I was very stressed most of the time. Looking back, I'm happy I did it. I'm glad it kind of saved me those 2 years. A lot of my friends mentioned like financially it was a very good move. At the time, that wasn't necessarily my thought. It was more so that this was like a path that I knew I wanted to go on. And this kind of offered me a very streamlined way of going about it. And like I said, it was a tough kind of 2 years, but it was something I could get through and ultimately go to medical school. I would recommend, I think, if it's available. I think kind of looking into it, I know there's like several kinds of BSMD programs kind of throughout the states. There's also like BSDO programs now, and they offer kind of a variable amount of like benefits, including some of them offer that you don't have to take the MCAT. My program did have us take the MCAT, although we only had to reach like a required score, which was lower than most because by the timeline we were supposed to take it, we wouldn't have taken, I think it was biochemistry. So they kind of tried to buffer for that fact. And we had to like teach ourselves biochemistry, which we did still eventually have to take. Yeah, so variable stresses and like variable costs and benefits in terms of like, you might be able to surpass something for the time. And if that's something you feel like would benefit you, definitely a worthwhile option to look into. I think I would recommend it to anyone looking into the programs they have now. Kind of the things that I like did in preparation for that I feel like made my application strong for the BSMD program were that I had worked with a lot of docs in terms of shadowing at the time. And I had, I think, like a letter written from one who I'd worked with a significant amount of time. I think they wrote a recommendation letter for me, along with like a letter from one of my science teachers who helped me prepare for like interviews for that program. So I think, and like my extracurriculars were very varied. In high school, I like did a lot of arts. But it was also part of like the pre-med group at my school. And I feel like academically I was in a general range of like the folks who would therefore like apply to pre-medical college stuff. So I think the things that really stuck out were like the things that would vary, which were the extracurriculars, and being involved in like a good amount of shadowing, I think like showed my kind of like dedication and like pursuit of the medical field ultimately.
Yeah, I was like about to say from like the previous thing that you mentioned about like nursing school, I mean, nursing homes and stuff, volunteering at those. I am actually volunteering at one. So that was really helpful for, I'm sorry.
Oh, you're good.
No, my Zoom just, I'm having some technical problems. Hold on. Let me fix it. Okay. Yeah, I'm actually volunteering at one, and I think you can start from like high school, if like just like call them and like ask them. So that was a really good point. And about like the BSMD programs too. I just wanted to ask, like, so was there any like other study methods that you use for like MCAT? Because I know it's like really competitive right now. Did any like apps or like a study method that you like really was like your favorite thing in in medical school, or right even now?
Yeah, so I have noticed after seeing like getting a lot of questions on MCAT and kind of trying to be like, I don't know, aware of like the resources that aren't there now. I've noticed it's evolved a lot since I took the MCAT. Back when I took it, I took the Kaplan course because I knew of the Kaplan course from when I studied for like ACT, I think. And I had like a good experience with them, and I felt like the way they put forward stuff made sense to me in terms of like I did like the course that offered like online teaching of topics, as well as like options for getting the question bank and everything. For me, I liked having like the virtual lectures. I thought they were really helpful in terms of like hearing and like seeing and having someone talk through a lot of concepts and helping those be cemented. But I think through medical school also, I found that like the best way for me to prep for things was just kind of to get a lot of exposure to questions, which now I know. I did a lot of UWorld in med school. Now there's a UWorld for MCAT, I believe, and like kind of a bunch of other question banks, which I think is helpful. I think getting into the kind of like the rhythm of like seeing how they ask questions, being able to like read questions as like a active test taker and everything, I think that's really beneficial, because ultimately the test is a test of knowledge, but also kind of like a test of like test taking and endurance. So I think getting more practice questions is really beneficial. And I know the last thing I did before I took my MCAT was look at the AAMC questions. I think they offer like man, I forget, but you could like buy like, I don't know, 4 sets of questions, and they had something else. I always recommend people to do those last, because those are like literally from the place that made the MCAT. So like they should be the most in style, like what you would see on the actual exam. And I don't know if there's Anki for MCAT, but essentially that was like a flashcard variable review kind of thing for MCAT. So if you're into flashcards, if that's something you've liked in the past, it could be like a good resource to look into. Anki, I guess, would be an app. At the time, we didn't have a lot of apps.
Going with like your day in life as a psychiatrist, how do you deal with like stressful days? You know, you probably have like a lot of patients who have like really acute like disorders and stuff. So how do you deal with those? Yeah.
That's a really good question. I think this is important. Finding ways to deal with stressful situations is notably like my whole job, but also something I have to work on myself. And like everyone has to work on in every setting. Typically, in the moment, I do what I can. And then I make sure I can set aside time for myself when I go home to like lean into the things I really like that are outside of medicine. I'm a huge proponent of the fact that like I love psychiatry. I think it's wonderful. I think it's like my calling and what I'm best suited to do. But at the end of the day, it is my job. And it's not my like primary sole definition by any means. I also like, I spend a lot of time, I have a wonderful boyfriend. I have a good group of friends. I actually love my co-residents. We're friends outside of work. We spend a lot of time together, like outside of work, either decompressing or just doing fun things, like plant shopping. I went plant shopping the other day with some of my co-residents. I like to get movement in, mostly like when I feel like I want it. I love going on walks and listening to audiobooks, cooking, watching TV, which is I think the most common one, something good on Netflix, and crafting. So I make, and like seeing my family. So I make sure to make time for any of the above, even if it's just like 30 minutes or less in my day that I said, like, I dedicated this time to myself. It's something I really wanted to do. It's usually like a good way for me to recoup. And I usually set aside like more than that, which is, I'm grateful in residency. I have that opportunity now for sure.
Yeah. I just wanted to like tell you guys, if you have any questions, feel free to like leave it in the chat. I'll ask her about it. I'll read it from the chat. I know I'm asking a lot of questions to her, but so other questions so you chose psychiatry over all the other fields in medicine, and I know you have like a little bit of like a family connection to it, but how does psychiatry particularly like differ from the other fields of medicine? Like, why did you choose to pursue that other than your family circumstances and about your father?
Yeah, so actually my dad was like very medically complex and like chronically ill, and I actually ended up just not like surpassing that completely and going to psychiatry. So mainly like pulls to psychiatry for me, when I'd never rotated in it, I'd never shadowed in it as like a student or anything. In fact, like it never was on my radar. I thought it was going to be like something that was too confidential for like anyone to get to shadow or students to get into. But in medical school, you rotate through essentially everything. You get 8 core rotations your 3rd year and some rotations in your 4th year. And it was my first rotation and I just fell in love with it. I thought it was the best. I loved that I got to talk to patients about like what I found to be like resonating with me, like true issues in a day-to-day life, like not talking to them about like their cholesterol or their diabetes or their blood pressure. Like, are you doing lifestyle modifications? Which I do talk to them about, but in a different context. I like to talk to them about like the harder things, like what got them down, what are their stressors, how have they been dealing with it, what kind of led them to this point in terms of like what kind of a life they've led, what circumstances they've experienced up until then, whether that's like abuse or growing up in like dysfunctional households, a whole slew of things, and getting to know a person like kind of very holistically before saying, okay, maybe this is like a good approach we can take going forward to help you tackle your stressors and improve your circumstances. So I found that to be really meaningful. And then like delving more into psychiatry, I liked the medication, I liked the pathology. I liked learning about it. I felt like I could continue to learn about it and not be bored, or find like reading really difficult to engage in. So it felt like a really good fit for me. I did get another message from Hafsa, mentioned, really enjoyed your advice on the extracurriculars and shadowing for high school students. Many of us are doing the same activities. So do you know any tips on how to stand out to colleges? So I feel like for this one, I'd go back to, I know everyone's kind of, like I said, doing the same thing, shadowing, working in nursing homes, scribing, I know is a thing now. So those are like the big tiers of like general, like getting into medicine and being able to do those things. I really think following things that you really enjoy in terms of extracurriculars sets you apart in terms of like showing that you have passions outside of medicine too, that like you're a holistic person. And I feel like not enough advice is given in terms of like, you should also pursue those things. Like in high school, I was in drama club, I was in show choir, I was in like multiple choirs in high school. I did academic debate, just kind of like an array of things. And they were like all very like, not necessarily connected, but just things I really enjoyed doing along with like that other stuff. And I got to talk about those things at interviews and stuff. And I felt like that was the passion you could show on like topics was what made me stand out. Even like now when I interview, we interview for like residents to come to our program for the following years. Even when I interview residents for the program or help interview like my med school and stuff, I feel like the things I usually take away are like those unique things that seemed to be like things people were really passionate about that made them stand out, those extracurriculars that didn't necessarily like have to have something to do with medicine, but that they could speak about really passionately. I could tell like this was something they really enjoyed. That would be my advice, like following anything else that also is something you really enjoy.
Okay, that was very helpful. I also got another message from Hafsa, and I know that you, as you said, you've interviewed a lot of medical students and residents, incoming residents. So do you have any tips on how to stand out among all the other interviewees, especially as a high school student or also as a college student?
Oh, good question. I feel like I'm gonna feel like a broken record. My biggest advice when people are interviewing is always just to be yourself, like the most yourself you can in an interview, because there's no one like you. You're a unique person, and getting that across in an interview is something that like will be impactful and like something you leave an impression of on the person you're interviewing with. I also recommend, when I was interviewing for like the BSMD program, I was approached actually by a teacher who was interested in like doing mock interviews with me, which I thought was really helpful. I don't know if that's like an ongoing thing in high schools. I know some high schools have like guidance counselors who offer mock interviews and stuff, or at least can like direct you to the resources of like general questions that you can be prepared for when it comes to interviewing. Might be worthwhile looking into that. And then when it comes to like preparing answers for like those kind of not generic, but like the questions that are very common when it comes to interviewing, just being able to like kind of link it back to things you're passionate about, whether that's in medicine or outside, and getting kind of that spark to come through when you're talking about those things in interviews, I feel like leaves good impressions on folks.
So a lot of high school students and also a lot of college students have like extracurriculars that are like kind of the same thing. So can you talk a little bit how you stood out from all the other people who did like drama club or anything else in high school? Like that's like kind of the same. Like how did you stand out?
That's a good question. So notably, like I didn't interview for college no, I didn't interview for college. I didn't interview technically for medical school. The interview process was like very cohesive and linked. So I kind of felt like it was one and all. But in high school, when I was trying to stand out, compared to like the other folks who, to be honest, there weren't a whole lot of people in drama club applying to like science. Well, a lot of them went into engineering actually, but not necessarily a lot of them going into medical school from my high school. But I tried my best to kind of share my experience and see how like what I took away from like those experiences. Like drama club was really enjoyable, but also like it helped me in terms of like help like curb my like public speaking anxiety that I had. It was like a good way for me to like put myself out there in almost a performative sense, and tackle that and feel more comfortable in that. Also like being part of a team is huge in like drama club particularly, and talking about how that felt like a strong suit for me in terms of that being like a really good quality I felt was something ultimately that would help me in the workforce or further in like my medical career. So kind of looking at it from like that aspect in terms of like, what have you taken away from this experience that you feel like is very formative, apart from even just enjoying it? And then I did get a message. How are ways you can handle the debt going into medical school? So I am unfortunately not the best person to talk about handling finances and debt. There are wonderful people who they keep who send us emails about financial planning and everything. They've talked to us through medical school. They've talked to us through even residency now. I have a financial planner that's like designated to me for this residency through the hospital. I always just end up telling folks like, typically none of us get through medical school without a bunch, like coming out with a bunch of debt. And it's like an anxiety provoking experience, but ultimately like it will be paid. Like once you're through residency and like an attending, it will get paid back. There are several like ways to do that. I know public loan forgiveness is like one of them, serving in like a distinct hospital or setting for like a set amount of years for your loans to be forgiven if they're like very, very surmountable. They're also very payable on like eventually like down the line an attending salary. And no one's going to ask you to like, you know, take the shirt off of your back to like pay your loan for sure. I feel like there's a lot of misconceptions on like how to manage or how impending the debt is once you get to like past medical school and like into like a job with salary. So I don't have the best advice on how to handle it, but more so reassurance that you will be able to handle it. Sorry, Nafisa.
It's fine. All right. Did you get any other questions or?
Did. Can you talk about how you balanced your personal social life with studying? Was it stressful? I'd like to know how long it took to complete assignments and perhaps a general description of how it was as a medical student. Tough question, but notably, I'm like a baseline anxious person, so all of the above was stressful. But definitely like balancing and like time management was like one thing to like help all of that stress in terms of balancing like social life and studying. I know in medical school, typically like my schedule included like taking one, at least besides the weekend, like one designated day off a week. That was usually like Friday, and my like friends and I would plan something we would do after like all of our lectures and all that to go enjoy. And having kind of that like scheduled time fit in, I think really helped kind of spacing out all of the other studying. It's definitely like an intensive process, and it's hard to like say. I don't know anyone who gets away from that in terms of like studying less or anything. I think so. Typically, like my medical school times, like the first 2 years are the ones that are more so didactic, or the ones that you're studying a lot in. So for those, typically like half of the day was spent in lecture, and the rest of the day was spent like reviewing those lectures and studying up on like either pre-studying on like lectures we were going to get the next day, or like following up on things we'd done before, along with like incorporating questions. So it was an intensive process. Assignments we didn't really have. We went to lectures, like several different classes were like every semester, and we eventually like studied for like a test that was like maybe every 2 months, every 3 months, depending on like what the module was about. So like anatomy, it was every 2 months or something. We would go through a whole body like system, and then we'd take a test along with like a practical about like the parts of the body we should know in terms of like the cadaver pinnings. I think what really helped me was like scheduling in that like day off as like a really big benefit, and like taking like a weekend or two off a month to go visit my family. And then most of the other time was like spent studying, but typically I also took like an hour off to like go to the gym and walk, or like walk around my neighborhood or something and like listen to something. And meal times were like non-negotiable times where I didn't study. So kind of fitting in like a schedule and like working it to what works for you was really beneficial in terms of like balancing all of it and making sure there was both time for obviously meals, some kind of movement, and like time for social things, whether that's with friends or with family, was big.
So like, how did you get motivated to actually complete your schedule for throughout the day or like throughout the week?
Good question. So I know this is also, I feel like, a broken record in medicine. That motivation is fleeting, but discipline is like resounding. So which, you know, the motivation's like really high in the beginning, you're ready to do all the things. And I would also schedule in mental health days for when I felt like, man, things are hitting the wall really hard. I really can't do this today. I need to have a break. So kind of the breakup of my schedule included like 1 or 2 mental health days if I needed it. Apart from that, kind of just like showing up for the other stuff. If motivation was really low, like showing up for like that dedicated time that I said, okay, from this time to this time, I will be doing this. And once it's done, at least it'll be done and I can move on to something else. That was kind of how I kept going, I guess.
All right, that was helpful. If you guys have any last minute questions, you can ask right now. And I think I'm going to present my screen. for like any wrap up like topics, I guess, slides.
Maybe ask me a personal question, so I'm just gonna direct it to my email, and apart from that, if you guys have questions, feel free to ask them.
Okay. All right. I'm gonna share my screen, Dr. Anjali.
Oh, this means I have to stop sharing, sorry. There we go.
Okay. So this is just like the question thing. So I just wanted to direct you to our social medias. So we have a TikTok and also an Instagram and obviously the YouTube channel where the recordings are uploaded. And so these over here to this side is where like the tags. And then all our Instagram is very important because all the updates go over there. So if you want to follow it right now, and that is about all. So you can obviously leave questions on her Instagram and also her email if you have any personal questions. And that is all for today. Thank you so much for coming here and for your time. I know you were very busy with like schedules and everything. And thank you all of you to attend for attending this meeting too. All right.
Thanks for having me, guys.
All right, you can feel free to leave now.
Yeah, thank you, Dr. Anjali, for coming on. That was great. I learned a lot. Also, we're gonna post this on Zoom. YouTube. So let us know if you want the recording or anything. Like I know our two previous panelists, like they asked us to what do you call it? They asked us to like send them the slides and send them like the recording. So like just let us know, I guess.